Hi everyone, my name is Treasure Barnes and I'm a second year PA student at South University in West Palm Beach, Florida. Today I'm going to be talking about the opioid and fentanyl crisis currently happening specifically in the state. If you don't know what a PA is, or physician associate, we're licensed medical providers that can practice medicine. We're able to diagnose and treat illnesses as well as prescribe medications. We work alongside doctors and other healthcare professionals like nurse practitioners and basically just try to provide the best quality of care for patients. So a little bit about me before we move on. I'm currently in my second year PA school. I'm in my fourth rotation, which is family medicine. I have about 7 months left out of a total of 27. And I've been living in Florida for about 7 years, but originally from Maryland. And I actually chose this topic because it hits close to home for me. A lot of people around me and my family have suffered from drug addiction and have even overdosed. So I thought this was the perfect time for me to try and bring awareness and educate myself as well as others. I just wanted to say that this video is strictly for educational purposes only. It's actually a part of my master's project and one of the objectives for Healthy People 2023. If you don't know what that is, it's a program set by the U.S. Department of Health and Human Services. And the program is basically designed to improve the health and quality of people across the U.S. over a 10-year span, and combating the opioid crisis is one of their goals right now. So I just wanted to provide a little background information on opioids before we jump right into it. And the discovery of opioids actually dates way back to 3400 BC, with it being cultivated by poppy plant seeds, as you may know. It really didn't take long for it to spread across the world and the nations, and it was in 1803 that morphine was first extracted from opium by a German pharmacist, Frederick Serturner. So stories say that he actually tested himself and a bunch of friends with the drug, and it caused them to have excessive drowsiness and pretty much knocked them out for hours at a time. So he eventually named the drug morphine after the Greek god Morpheus, which is the god of dreams. So I thought that was a pretty interesting fact. By 1817, morphine was basically used for acute and chronic pain, but it wasn't long after until that doctors warned about its addictive characteristics, and the distribution actually slowed down dramatically. Then in 1898, Bayer Company discovered heroin and pretty much marketed it as a wonder drug for respiratory diseases and for cough. It was said to be less addictive and more potent, but by 1905, heroin addiction actually skyrocketed across the US. And it was mostly used by young adults because of its euphoric effects. And within a year, it was actually banned by Congress. So a few years later, in 1909, Congress actually passed the Opium Exclusion Act, banning the importation of opium completely. But just a few years later, in 1916, Oxycontin was introduced, which is another opioid. And again, by a German scientist. And by 1980, fentanyl and Vicodin came along as well. So by 1996, both Vicodin and Oxy became the #1 promoted drugs and was distributed by a majority of doctors. Fentanyl, on the other hand, even now and historically, was basically used for severe pain, such as in cancer, and for surgical anesthesia because of how potent it is. And as we'll talk about later on, it's become like a real problem, and now one of the main concerns with the opioid epidemic. So that's just a little background info. And while there's so many more opioids out there that I didn't mention, some of the most common ones that I'm sure you heard of are morphine, heroin, Oxycontin, hydrocodone, and fentanyl. And so what these drugs do basically are attached to proteins known as immune receptors on brain cells, and they trigger the release of the chemical dopamine, which we also know as the reward chemical. This reward process is what initially causes the repeated use of drugs, and when it's done over and over, the opioid receptors eventually become less responsive and more of the drug is needed to produce the feeling of pleasure. So this is the basic process of what actually leads to tolerance and abuse, and eventually addiction. So as I stated earlier, by the 1990s and early 2000s, the number of prescription opioids such as Vicodin and Oxy were dispensed at remarkably high rates, resulting in an increase in overdose deaths. This is actually known as the first wave of the opioid epidemic, and the second wave came in around 2010 with an increase in heroin-related deaths. The third wave, which we're currently dealing with now, and that started in 2013, is with a rise in synthetic opioid-related deaths, which includes fentanyl and carfentanil. These drugs are primarily being synthesized in the black market and being combined or laced with other drugs such as cocaine, heroin, and stimulants. What we're seeing now is a lot of young people dying from these drugs, and what they think that they're buying off the street is actually being laced with fentanyl. And fentanyl is about 100 times more potent than morphine, and carfentanil is even more potent than fentanyl alone. So they're extremely dangerous. So although my research is primarily based in Florida, studies have shown that the number of prescription opioids across the nation has drastically reduced by 44.4% between 2011 and 2020. On top of this, the number of naloxone prescriptions, which is a medication that reverses the effects of opioids in case of an overdose, has also increased significantly. Which all of this is great, but even with such progress, the number of opioid-related deaths has increased by 10.8% across the nation and by 42% alone in the state of Florida. What's more alarming is that overdose is now the leading cause of injury death in the U.S., surpassing cardiovascular disease-related deaths, falls, and even car accidents. So I wanted to ask you a question, and just to really get you thinking and, stimulate your mind a little bit. So how many people do you think die each day from opioid-related overdose? If you answered 175 to 200, you're correct. So about 190 people die each day from opioid overdoses. And recent studies have actually shown that in 2020, more than 270 people died of an overdose each day. Another question I wanted to ask is, which age group do you think is most affected by the opioid crisis? So the answer is the age group 25 to 35. Those aged 25 to 35 are more likely to suffer from opioid addiction, and white males in this age range are actually twice as likely to be affected than women. So I just wanted to get you thinking there and really show those stats, which are really sad and alarming. 25 to 35 is so young, and it's honestly just disheartening. I recently went to a dinner on the fentanyl crisis by Retreat Behavioral Health, and there were a bunch of guest speakers who majority were parents talking about their kids overdosing. I think the youngest one was a 14-year-old, and majority of the kids were actually taking something for the first time, and because it was laced with fentanyl, they passed away. So it was just really sad, and I think that with everything going on in the world, with the COVID pandemic and, with the politics, this is just not being talked about enough. So hopefully, we can bring more awareness and just educate more. So I'm going to talk about Florida and what's happening here. Florida is actually one of the top states behind Cali with the highest overdose rates. The state alone accounts for 7.49% of the nation's overdose deaths, which may not seem like a lot, but it's 23% above the national average death rate. So this could possibly be traced back to the pill mills that occurred during 2003 and 2010. A lot of doctors and pain clinics were dispensing large quantities of prescription drugs for cash, which was completely outside of their scope of practice. And this caused a drastic increase in opioid overdoses in Florida. Laws did go into effect in 2011, which did bring down the death rate from overdoses, but we're still just dealing with a major problem. And what that is really just fentanyl and its analog. So according to a 2020 Florida Medical Examiner report, occurrences of fentanyl deaths increased by 63% from the year prior. This is likely because of the widespread availability, with it now being, made in labs and being sold on the black market. The counties right now in Florida that have the highest overdose rates with fentanyl are Palm Beach County, Broward County, which is where I reside, Miami-Dade, and Sarasota, which is on the west coast of Florida. Again, white working males are the age group that is mostly affected by this. So to put it into perspective even more, about 2.7% of Florida's population actually suffers from an illicit drug problem. And in 2017, the governor did declare a state of emergency. Funding was even drastically increased, but little progress has been made. So some of the factors that I came across that could possibly contribute to the opioid crisis were, one, the lack of awareness. So this is a major problem because, like I said before, with everything going on in the world, with COVID, there has been little light shed on the crisis. I know myself, I barely see or hear about the dangers of opioids, and it's sad because data shows it's killing more Americans than ever right now. One of the goals of Healthy People 2030 is to outreach on a community-based level and even inside the home. I don't think people realize the dangers of just taking one pill, especially with the increase in them being laced these days. So I feel like that's pretty important. Another thing that I found when doing research was lack of education. So I read that a lot of physicians barely receive any training on the pathophysiology behind pain in general, and also substance use disorders. So I thought that was a little odd, just the fact that the opioid crisis, a lot of people will say stems from overprescribing in the past. And, it's hard to not believe, especially, one study that I found showed that non-Hispanic whites were almost 3 times more likely to receive opioids from doctors than any other race. And this is the same group that right now is mostly being affected. So, kind of makes sense. Another thing I found was lack of access to treatment centers and resources, which is kind of obvious, but unfortunate. It's a huge barrier, and most of the people that suffer from opioid use disorder either don't have insurance, or there's some gap with insurance when it comes to coverage for treatment centers. Most of the time, even if a person does have insurance, the rehab stay is usually about 30 days. Which isn't long enough, and the average cost ranges from $20,000 to $30,000. So speaking of lack of access, so majority of patients who suffer from opioid use disorder actually also have an additional mental health or psych disorder, and they are unable to get the proper help that they need. So that's also, a possible cause. The COVID-19 pandemic, is another problem right now that is contributing to the opioid crisis. Research has shown that since the pandemic started, its effect on mental health has increased substance abuse. And the CDC actually reported its highest ever recorded rates of OD in 2020 and believe it's likely from the pandemic. There was also a survey conducted in Florida on about 780 residents, and 18% of those people reported more daily use of opioids since COVID has started, and they reported using multiple times a day compared to before the pandemic. So In addition to that, the CDC also reported that essential workers even began using a substance in 2020. So what we're basically dealing with now is an epidemic inside of a pandemic. So whether you believe it or not, the opioid epidemic affects us all, basically on all levels, especially, social and a fundamental level. So the economic burden of the opioid epidemic is costing us big time. Societal costs, which include healthcare, loss of life, criminal justice, and workplace costs, are estimated to be around $78.5 billion annually, and this number could be even higher than estimated. Florida alone lost about $97.1 billion in recent years because of the use of opioids that has resulted in less workers in this economy. And as far as the medical field, in 2018, Florida hospitals treated roughly 18,000 emergency department patients who overdosed on opioids. Among those patients, 10% were being treated for a second overdose or more. This also doesn't include admissions for opioid-related infections from injecting drugs, and most of these patients don't even have insurance. So this places a significant burden on hospitals and its staff. Also, while we know white males are currently affected the most by the crisis, recent studies have shown an increase in overdose deaths in Black and Hispanic communities. On top of all this, surprisingly, the average life expectancy in the US has even decreased from the epidemic due to its tolls on young adults. And we can't forget to, mention the emotional toll that this has on both families and loved ones. So I wanted to share this video before moving on. I thought it was pretty interesting and good because some of these, signs we wouldn't even think about. So
I'm Dr. John Billen. I'm one of the board-certified family physicians here at Maryland Primary Care Physicians. Opioid abuse is no longer something that anyone should ignore. Abuse often begins innocently with prescribed painkillers like oxycodone, hydrocodone, and morphine. If these drugs are misused, it can quickly lead to addiction. If you think someone near you may be at risk, your reaching out could save a life. Here are 4 warning signs to watch out for. 1. Withdrawing from normal activities. A person may suddenly stop doing the things they used to enjoy, or they may become emotionally withdrawn and isolated. 2. This may sound funny, but constipation that is severe or frequent is another sign. Constipation is a very common side effect of opioid use. If someone is frequently using laxatives, it may indicate that opioids are a problem. 3. Doctor shopping. If someone starts seeing many different doctors, perhaps even traveling some distance, there may be an opioid problem. They may be looking for a doctor who will prescribe opioids without asking too many questions. And 4. Using cop-outs or excuses when confronted about drug use. A person may claim that they only tried it once or it's only for friends, not them. The truth is that addiction can lead otherwise honest people to say almost anything to keep their habit going. Opioids simply cannot be used as a recreational drug without risking addiction or death. And the appeal of cheaper street opioids like heroin leads to extreme danger of overdose. Street drugs may contain fentanyl or carfentanil that can kill in extremely small doses. So if you're seeing the signs of opioid abuse in someone near you, please reach out, talk to your doctor, or call this hotline. There is someone to talk to, and you just might save someone's life.
So I'm sure you're wondering what is currently, being done to, combat the opioid crisis. And really, it's such a complex issue because as much as it's a social problem, it's also a structural problem. And as you can see, it's like we move from one problem to the next, because we are dealing with multiple waves of the problem. And there's just so many barriers that are affecting, people getting treatment and everything. So a few things that I think need to be addressed, and I wanted to share, just my own insight, is that I think a major thing that needs to be done is reducing the stigma around opioid misuse and addiction. Again, I would like to say that, it is a disease, which many people, will argue and say that it's not, but you can read up on that yourself. However, Many people think that those with addiction are to blame and don't want help, but that's not true at all. Studies have shown people can be predisposed to addiction due to genetics or even if they have concurrent mental health disorders. So we must educate people to reduce the negative attitudes around opioid use disorder and, try to reduce using the terms such as addict or abuse, because these things alone can prevent people from seeking proper treatment they need. Another factor in this is providing access to care for those patients that don't just have substance use disorder, but also mental health disorder. Both of these overlap and collide, and mental illness can actually increase the risk of opioid use disorder, specifically in young adults. I know that the Florida Department of Health is currently trying to remove prior authorization requirements for behavioral health services, as well as take away the limits for the number of visits. However, a big issue remains that there's a lack of mental health providers. Again, as I stated earlier, reducing the financial barriers for treatment centers and rehabs is a major issue. The cost alone is outrageous, and many people with opioid use disorder have no insurance. This is a very difficult problem to address, but it's actually said that 85% of people relapse within 1 year of treatment. And after doing, all my research and stuff, I believe it's because the average length of stay is around 30 days, which isn't enough time. And so more needs to be done to have longer stays covered by insurance. I know a Florida organization known as Project Opioid has actually partnered with Florida Blue to expand resources. So this is a great start and hopefully can be implemented in other states as well. Prior authorizations is another huge barrier in getting treatment. Pain medicine specialists have reported numerous times and over years spending hours on prior auths on medications, and that there's such a reduction in the quantity or doses of medications that patients can receive. As of now, first-line treatment of opioid use disorder is methadone or buprenorphine, so we must expand these treatment options in any way possible without financial barriers. Here in Florida, Medicare will actually cover both these medications without any fees under a program that they have. Another thing I came across was lack of knowledge by med students and physicians when it comes to substance use disorder and pain management. Like I said, which is, kind of surprising because of the history with the opioid epidemic, but I do believe implementing this subject in medical school right away would be beneficial, because this can't be controlled by just pain medicine doctors, psychiatrists, or even addiction medicine specialists. As medical providers, even myself as a PA, we have a specific role that we need to provide, and even primary care physicians, we all have a role to, in combating this crisis. Finally, we must expand access to naloxone distribution centers and needle exchange programs to reduce the infectious disease transmission rate. Although recent reports by the AMA stated an increase in prescribing of naloxone, there are still so many areas considered treatment deserts, specifically in the Black and Hispanic communities. Rural areas also had the lowest dispensing rates, and those with insurances such as Medicare even had to pay a copay for these medications. So I think educating more in this matter as well would be extremely helpful. And the CDC does recommend offering naloxone to all patients at risk of overdose. So this is important too to educate, providers about. So before, ending this, I wanted to share a video about recognizing the signs of overdose, as well as using Narcan or naloxone. Because you never know when you will come across someone that is overdosing maybe, or, just for educational purposes,
Before we talk about what to do during an opioid overdose, let's look at the list of opioids. It includes the street drugs heroin and fentanyl, as well as prescription pain medications. Anyone taking prescription or street opioids is at risk for an overdose. Those who are at greatest risk inject opioids, take higher doses, mix opioids with other medications that may cause sedation or have a pre-existing medical condition. An opioid overdose can lead to death if not treated. Here are some signs of a possible overdose. It's hard to wake the person up, or they seem overly sleepy or confused. Their breathing has slowed or stopped. Their pupils are the size of pinpoints. Their lips or fingernails are blue. If you see any of these signs and you suspect an overdose, call 911 immediately. Then administer the naloxone, also called Narcan nasal spray. Remember, naloxone only works on opioids. It will not treat an overdose from sedating medications such as benzodiazepines, which include Valium, Klonopin, Ativan, and Xanax. Start by moving the person to their back, then follow the 3 Ps: peel, place, and press. Take the spray out of the box and peel back the corner tab to open. Hold the spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Tilt the person's head back and support their neck with your hand. Gently place the tip of the nozzle into either nostril until your fingers are against the bottom of their nose. Press the plunger firmly and all the way to give the entire dose. There is only one dose, so do not test it first. Then roll the person to their left side. If they do not wake up in 2 or 3 minutes, administer a second dose of naloxone. Stay near them until emergency medical help arrives. Contact your local pharmacy to find the most convenient location to purchase naloxone. More detailed instructions on how to use naloxone can be found inside the package. Preventing deaths caused by opioid overdose starts with all of us. We share the responsibility of safe care for everyone in our community.
So I hope you enjoyed that and the short educational video on the opioid crisis and what's currently going on. I hope to come back on here soon and provide more in-depth information. Just wanted to show this is what Narcan looks like, and it's pretty small. Me and my friends actually try to keep this with us at all times, just in case of emergencies. Never know where you're gonna be. So that's what that looks like, and it is 4 milligrams. So yeah, thank you for watching, and take care.